Hello, in this session we are going to talk about how to approach a short case of sebaceous cyst. So as we talked in previous session, we can go with the SPACEPIT approach. The 5S, size, shape, skin, surface. Second part is the pace, plane, attachment, consistency and edge. The third part is the PIT, pulsatility, inflammatory changes and transillumination. For the first part, 5S. For the side, sebaceous cysts are most common on scalp and hair areas. The size is about medium to large size. You can measure it in centimeters. The shape is those sebaceous cysts are hemispherical. The skin of the sebaceous cyst, about 50% of them have a punctum, and there is a bluish discoloration of the skin. The surface is smooth. The second part is the base. The plane is subcutaneous. It is sebaceous cysts are always attached to skin. You can demonstrate that in examination. The consistency is soft to firm. The edges are well defined. The third part is the pit. There is no pulsatility in the sebaceous cyst, but they are fluctuant. The inflammatory changes are present. There can be warmth, erythema and tenderness around the sebaceous cyst. The sebaceous cysts are not transilluminant because they have a thick sebum. When we talk about sebaceous cysts, we can classify them into two main types to the histological subtypes. They are epidermal cyst and tricholemous cyst. Epidermal cysts are developed from squamous epithelium, and the tricholemous cysts are developed from the hair follicle epithelium, and they are the one most common on scalp, and they can rarely undergo malignant transformation. There are 5 cardinal features of sebaceous cyst. These features will help you to diagnose a sebaceous cyst in examination. They are the presence of punctum, bluish discoloration, skin attachment, well-defined margin, cystic nature. Those 5, not the all 5 present, but there are many features present in a case. Okay. What are the complications of the sebaceous cyst? Infection. Infection is the most frequent complication, and in examination there can be associated discharge with the sebaceous cyst. The ulceration. There can be calcification, and when the calcified sebaceous cyst may feel hard on palpation, and there can be sebaceous horn formation. It is the hardening of a slow discharge of sebum for a white punctum, and as I told you previously, it can rarely undergo malignant changes. For the management of sebaceous cyst, we can go for non-surgical or surgical approach. For the non-surgical approach, if the cyst is small and asymptomatic, we can left alone it. But for the surgical management, we have to go for the complete excision. That's all for the quick review of the sebaceous cyst.